Swadikap, good afternoon once again. Today is Wednesday, the 11th of August 2021, and this is the English language summary of the daily press briefing here at the CCSA. So thank you, Dr. The spokesperson for the Thai language briefing just now. He mentioned a lot of important issues. I'd like just to mention one first, is that he mentioned about the local ingenuity, meaning that in Thailand, a lot of local things have been used, a lot of the measures have been localized, meaning in terms of home isolation, as we had talked about in the past, the home isolation in the provinces have been conducted in villages, for example, and of course we have the Fatalities herbal medicine as well. Now, just to mention that Thailand now is ranked at number 35 around the world. We've moved up the scale, hoping that we will not move to the highest, of course, number 35 in the world in terms of infections. Nevertheless, the EOC, or the Emergency Operations Center of the Ministry of Public Health, has been meeting regularly. For example, they met today, this morning as well, and they had a teleconference as well with the Bangkok Metropolitan Administration, where in Bangkok it remains the city, the province, with the highest number of infection rate. Today, Bangkok recorded 4,525. In terms of the hospital beds around the country, we have information that the situation is getting better because of the provision and the creation of more hospital beds in the provinces, more hospital beds facilities around the country. So therefore, the number of patients needing hospital beds are not concentrated only in the Bangkok area. Those found positive of COVID have been seeking medical treatment, have been treated in medical facilities around the country as well. In terms of the death cases, the fatalities, one important piece of information is that our fatality rate is not very high compared to other countries around the world. That remains so today, when we have around, for a ratio of 1 million persons, we have only around 89 who would succumb to COVID. Now, the fatality rate in Thailand is concentrated on the elderly, those who are aged, and of course those who have the 7 underlying diseases, as we had mentioned quite often. So therefore, it remains very important for these priority groups to be vaccinated, for the whole group, for the entire population of the elderly people in Thailand, as well as those with 7 underlying diseases. So thus, that is why we have the vaccination priority. Although the vaccination scheme, of course, is now open to the wider group of general public, those 18 and above, both for Thai nationals and for foreign nationals. Another information is that our rapid team, which we call the CCRT, the rapid COVID team, which is actually the mobile unit which travels quite quickly to hotspots to conduct active case finding, to conduct the antigen test, the ATK. In the past 24 hours, just as one example, the CCRT rapid response or rapid mobile team had already found through the antigen test between 1,000 to 2,000 persons being positive with COVID in the past 24 hours. So I'm sorry, I misspoke that. That was 1,000 to 2,000 people who were tested with the antigen test, and this is actually one of the missions that had been going on in the past months already, in order to conduct the active case testing through antigen test. So I'd like to start off with the vaccination progress that we have for today. We have a good number, another new high number in our daily vaccination progress, which is 546,000 doses which were administered yesterday, making the cumulative number of doses in Thailand at over 21.6 7 million doses. And you have that on screen for you between the first dose, second dose, and the third booster dose. So hoping that we'll be having the high number of shots daily. The highest number we had of yesterday was, a few days ago, was 670. 2 days ago was 670,000 doses in one day. So today we have 546,000 doses. For vaccination of foreign residents, that continues, as we mentioned earlier, as of the 10th of August, yesterday. We have a total of 48,016 foreign nationals from all age groups who have registered via the website that we announced, which is expatvac.consular.go.th. This is, of course, the collaboration between the Ministry of Foreign Affairs and the Ministry of Public Health. And as previously mentioned, all age groups can register for the first dose of vaccine via this website, but priority will be given to the vulnerable groups, the same criteria as Thai nationals, which includes elderly, pregnant women, and those with underlying chronic diseases. And actually, these groups are the ones most at risk in terms of the risk of fatality, as I mentioned at the beginning of this briefing. Just a soft reminder that registered foreign residents will be notified of the dates and vaccination sites in the vaccination locations in accordance with the level of risk and the location of residence. So some of you might be anxious already that you have registered but you have not received the appointment. That will be forthcoming. Many who have registered in this scheme have already received the appointment date or the vaccination itself. So please be patient, as everyone who have registered will be designated provided with the date and time according to the conditions and the various limitations that we have. Now, just for the general situation, we have new confirmed case at 21,038, and we have new recoveries at 22,012. So you can notice that the new recoveries is meeting up with the number of new confirmed cases. So perhaps it's the cycle, meaning that 2 weeks ago or 2 weeks plus ago, there had been a high number of those who were positive, and come 2 weeks later or more than 2 weeks later, we now have these people recovering. So the recovery rate is ongoing. It's quite good. It's good that the sickness, the infection is not prolonged, and we hope that the new confirmed case will not rise higher than this. We've had over 20,000 for a few days already. Now, out of the active cases, we have now 210,000, over 210,000 active cases, as you see on screen. And out of this number, around 61,000 are active cases being treated in hospitals. And around 140,000 of this number are treated in field hospitals. Now, the 140K in field hospitals currently being treated are actually those who do not have severe symptoms. So thus, they are in the field hospitals. And hoping that the fatality rate will not rise above this, we have recorded today at 207 deaths. Making the cumulative total at over 6,700, which is 0.8%, and the median age remains as the senior citizens, the median age being at 64 years old, hoping that this will not increase further. The Bangkok, of course, as mentioned, saw the highest fatality rate as well as the highest infection rate. And most of the fatalities we have are people at the age of 60 and over, which is actually around 58% of all fatalities recorded for today. The number of fatalities is unfortunately also increasing in every region of the country. So as you can see, although we have a recovery rate, which is quite good, people who are sick with infected with COVID, they recover when they receive the proper medical attention. They have less risk of death if they are vaccinated, but the fatality rate still remains at 200 plus for today. And some observations from the meeting that we had this morning and the briefing in Thai from Dr. Tuwisin, with Bangkok having the highest number of infections today at 4,525. and followed by other provinces, mostly in the central region, like Samut Sakhon and Samut Prakan province. And you have the tally there up on screen for you. The number of infections mostly concentrated in Bangkok and surrounding provinces, and those designated as the highly maximum controlled area, which is actually, in the general picture, that is actually stabilizing. While some provinces are already seeing a decline of the number of infected COVID patients. The number of patients with critical conditions and fatalities are also stabilizing, both in Bangkok and the nearby provinces. However, the numbers are increasing amongst groups that have yet to be inoculated or have been inoculated with only one shot only, as well as mentioned, elderly and those with chronic diseases. So the next step for the vaccination progress is actually to expand this to a wider number of locations, as well as larger numbers of groups, more people in the elderly group, more people in the chronic disease group, pregnant women, as well as in the future children ages 12 and over with chronic diseases as well. Now for the various provinces, we have new clusters, mostly found in factories, and they will undergo the bubble and seal process to control the spread of the infections. We have, for example, Nakhon Pathom with the highest number of cases with critical conditions, which is 364. And we have Thai vaccine, where the Faculty of Medicine of Chulalongkorn University announced the closure of the applications for volunteers to participate in this trial. They closed this on the 7th of August, as the number of volunteers have been reached already. So the Thai mRNA vaccine trial registration was launched in early August, and volunteers were required to be at the age range of 56 to 75 with no chronic diseases, and should have never been infected with COVID-19 or have yet to receive the COVID shot. So the Chula Vaccine Research Center, or CVRC, conducted the successful vaccination trials on non-human. These are non-human trials before the first phase of the human trials began on the 14th of June. And the second phase is set to begin at the end of August. So that's progress there. So just in closing, I'd just like to reiterate from the beginning that when Dr. Tui Sin mentioned about Thai ingenuity, we mentioned in some of the past briefings about the home isolation in various villages around the country to make people feel at home when they are sick. So home isolation is very important and a part of everyday life for people who are sick in the provinces. We've integrated that into villages, into the Thai way of taking care of each other. So that's very homey and a very good Thai ingenuity in this time of COVID. Just to direct your attention also to our last slide from the World Health Organization today. With the new variants from the COVID, it's known that some of these appear to be spreading more wider, spreading easier between people. So just allow me to stress that once again, the importance of mask wearing and constantly washing hands and respecting and observing social distancing. And of course, vaccination remains very important to prevent any severe symptoms or even death from COVID once you are infected. So with that note, I thank you for your attention and we'll see you again next time. Sawadee krap.